Hello everyone, I'm Dr. Ashwin Tamhankar. I'm consultant in Urological Cancer Division as a part of Cancer Division of Apollo Hospitals, Navi, Mumbai. Today we are here to discuss about prostate cancer awareness. Basically, 13th to 19th of June of this particular year, which is next week, it is considered to be the International Men's Health Awareness Week. One of the essential pillars of men's health is prostate health and prostate cancer. There is a reason for it. If we actually see the global statistics, prostate cancer amounts to 14.3% new cancers every year across globe in all men, which is the second most common cancer. The most common being lung cancer, which amounts to 14.6%. So not much of a difference. Because of the recent increase in the incidence and prevalence of prostate cancer, probably in another couple of years' time, it will be the most common cancer in all men across the globe. And that's why it is important to have more awareness towards it. Unfortunately, that is what is lacking in India, and that's why we are here for. So, talking about prostate cancer across the globe, in general, nearly 1.3 million new cases get diagnosed, and approximately 3.5 lakh people succumb to this cancer every year in spite of advances in the treatment. The main advantage of early diagnosis and early treatment is only possible when we actually screen the individual. The screening tests, which are, if I can correlate that, for example, there is a screening test available for breast cancer, which is called as mammography, or there is a screening test for cervical cancer in females, which is called as pap smear. In the similar manner, in men, this is the only important screen-detected cancer across men across the globe. So, prostate cancer screening essentially is done by two parameters or two types of tests. One is a simple blood test that is called as PSA, which stands for serum prostate specific antigen. It's a molecule produced by prostate gland. In cancerous prostates, it is produced in a larger quantity, and thereby we have an opportunity to detect that on a simple blood test, which the results of which are available within 4 to 5 hours. In addition to this PSA test, another important pillar of this screening is a physical examination of a prostate from an expert, which tells you a suspicion of having a prostate cancer, yes or no. So if we combine these two tests, the chances of picking up prostate cancer at a very early stage are very bright, thereby sensitivity increases. And whenever any of these tests are abnormal, we take a next step for diagnosing the prostate cancer by doing an MRI of the prostate and then the biopsy of the prostate after that. One important finding here is on the Western countries or across the globe, if we see American statistics, they start this screening program from the age of 55 years plus. By this I mean every man with or without symptoms of urination will undergo a prostate screening test, that is examination and a blood test called PSA, once a year starting from the age of 55 plus. In American, this was for American standards. In UK and European statistics, after the age of 50 years, every man undergoes battery of these two tests to get screened from prostate cancer, and if obviously any of the tests are abnormal, we are going to investigate further for proving or ruling out prostate cancer. In India, unfortunately, we do not have these robust guidelines, and the essential or the most worrisome factor, I would say, is lack of awareness about the cancer itself, lack of awareness about this particular entity, and lack of awareness about this screening modality. By a battery of two simple tests, which can be done once a year without any extra cost, if you're gaining from ruling out a cancer on regular occasions, which is a screen detectable cancer across the globe, I think we have achieved something out of it. So this, on the occasion of this particular week, we are going to organize a screening camp in Apollo Hospital, which will be a combination of blood test, a urine test, and an examination by an expert. So please, I would urge everyone, if you have understood this message, I would urge everyone to come forward to get yourself screened for prostate cancer, which is an important parameter of men's health. Thank you so much.